Welcome to The Explainer. Today, we are creating the ultimate study guide for one of the most critical skills you'll ever learn, reconstituting powdered medications. I know it sounds a little intimidating, but this is a skill that's part science, part careful attention to detail, and it is absolutely essential for safe practice and, you guessed it, for acing the NCLEX. Let's dive in and master this together.
So here's our game plan. We're going to build your knowledge from the ground up. We'll start with the why, then we'll get into decoding those tricky medication labels. After that, we'll walk through the actual procedure step by step. Then comes everyone's favorite part, dosage calculations. And we'll wrap it all up with some can't-miss NCLEX tips and a case scenario to really test your clinical judgment.
Okay, let's dive right into Section 1 by starting with the absolute basics. Why do some medications come in powdered form in the first place? Why the extra step? It's not just to make our jobs harder, I promise. There's a really important reason for it.
The key reason is stability. It really all comes down to that one word. See, some drugs just aren't stable for long periods of time when they're in a liquid state. They lose their potency, they break down. So by keeping them as a powder, manufacturers can ensure the medication is at its full strength right when you're about to give it to the patient.
Getting these terms right is the very first step, because you're going to see them on every single label and order you encounter. You've got the powdered medication itself, the diluent, which is just the liquid you add to it, and the vial, which is the glass bottle holding the powder. Simple, right? But it's totally foundational. Now, what's really interesting and kind of tricky is how manufacturers present all this information. Because believe me, no two labels are exactly alike. This is where you have to put on your detective hat and really pay attention to the details.
Take a look at this first label for ceftazidime. This one is great. It's super clear. It tells you exactly what to do. Add 26 milliliters of sterile water. It gives you the final concentration, 1 gram per 5 milliliters, which is absolutely crucial for your math later. It even tells you how long it's good for. And notice that last part. It's a multi-dose vial, which means we'll have more work to do after we mix it.
This second label introduces a few more things you've got to look for. You've got your brand and generic names, of course, but look closer. You need to find the route of administration. Is this going IV, IM, or is it oral? You also need the exact type and amount of dilute. And finally, when does it expire after you've mixed it? All critical pieces of the puzzle.
So here's the most crucial point I can make. You have to be prepared for labels that don't give you everything up front. Look at the difference here. The first label has it all. But what about this third one? It's missing the type of diluent, how much to add, and the expiration info. So what do? You find the manufacturer's package insert. That is your ultimate source of truth. Never guess.
And speaking of diluents, always double-check which one is required. They are not interchangeable. Using the wrong one can inactivate the medication or, even worse, seriously harm the patient. For anything that's injected, it has to be a sterile fluid. But for oral meds, sometimes simple tap water is all you need. The label is law.
Okay, so we've read the label, we've found our info, now it's time to actually do it. Let's move to the physical steps and see how this all builds into a safe and effective procedure.
Following these 5 steps every single time is your best defense against making a medication error. First, wash your hands and get your supplies. Then, double-check that you have the right diluent and draw up the precise amount. Inject it into the vial and then mix it gently, usually by rolling it between your hands, not shaking it. And finally, withdraw the prescribed dose. Systematically, every time.
Now remember we talked about multi-dose vials. Well, if you've just mixed one, this next step is absolutely non-negotiable. You have to label it. This label communicates vital safety information to the next nurse. It needs the concentration, the date and time you prepped it, when it expires, how to store it, and your initials. It's all about keeping the next patient and the next nurse safe.
And now for the part everyone loves, dosage calculations. But seriously, don't sweat it. The math is usually pretty straightforward once you know where to find the numbers on the label. Let's walk through a couple of common scenarios.
All right, first problem, the order is for 125 milligrams of methylprednisolone IV. You've just reconstituted the vial, and according to the label, your final concentration is 62.5 milligrams per milliliter.
So, the big question is, how many milliliters are you going to draw up into that syringe? Go ahead and pause here for a second and try to solve it yourself.
Did you get it? The correct answer is 2 milliliters. You just use the classic formula, what you want, which is 125 milligrams, divided by what you have on hand, which is 62.5 milligrams per milliliter, and that gives you 2 milliliters. Easy as that.
Let's try one more to make sure it sticks. The order this time is for 500 milligrams of ampicillin given IM. After you've reconstituted it, the vial says your strength is now 250 milligrams per ml. Okay, based on that, how many mLs should the nurse administer for this dose? You know the drill.
And the answer, once again, is 2 milliliters. See the pattern? It's always the desired dose over what you have on hand. 500 divided by 250 equals 2. You've totally got this.
Now, let's connect all of this to how you'll be tested on the NCLEX, and even more importantly, how you'll use this exact thought process in real-world practice to keep your patients safe.
Okay, these are some high-yield facts, your NCLEX memory anchors. For labeling that multi-dose vial, remember this mnemonic. Doctor told me daily since infection. That's for dosage, time, medication concentration, date it expires, storage, and your initials. And the syringe rule is absolute. Oral meds get oral syringes, parenteral meds get parenteral syringes. No exceptions. That's a huge patient safety rule.
And this is a perfect illustration of the nursing process, which is the heart of the next-gen NCLEX. You recognize cues, that's reading the label. You analyze those cues, that's understanding what single-use vial actually means. And then you take action by calculating the dose and labeling it. It's not just about doing the steps, it's about understanding the why behind them. That's clinical judgment.
Let's finish up with a quick case scenario to put all this newfound knowledge to the test. This is where the rubber really meets the road. So, picture this. You're in the medication room preparing a drug for a newborn. You read the label on the vial, and it tells you to use bacteriostatic water with benzyl alcohol. But right below that, in bold letters, it warns you not to use this specific formulation in neonates. So, what is your priority action? What do you do next? This exact moment is where knowledge meets action to protect a patient. Recognizing that warning, analyzing what it means for your specific vulnerable patient, and then deciding on the right thing to do, that's the essence of being a safe, competent nurse. Think about it, and we'll see you in the next Explain.